Hi, I'm Dr. Abdullahi with California Advanced Pain and Spine Specialists, and I wanted to take a couple minutes today to talk about intrathecal pumps, or morphine pumps, or pain pumps, as some people call them. A lot of people don't know too much about them, and wanted to just spend a couple minutes to better educate people on what exactly they are. So what is an intrathecal pump? Well, first, it's a pump, and this is what it looks like. Sometimes people say it's so big. Why is it so big? Because it's a pump that holds a liquid in it. And the pump itself isn't this big. It's largely just a reservoir that holds the liquid that it's pumping out. So it's like your fuel tank. The size of the fuel tank is just how much fuel it holds, and this holds the amount of liquid that it does. So the second part of the name, intrathecal pump, is intrathecal. So there's different layers in your back where the nerves run and the spinal cord is. The intrathecal space is the liquid that sits around the nerves and the spinal cord itself. If we look at this model here, it would be where this yellow is that runs up and down the back. What an intrathecal pump allows us to do is put a little tube or catheter into this liquid and lets us inject medication directly into this fluid. What that allows is patients get much less medication than they would if they took it orally. The medication works much better than it would if it was taken orally, and there's much less side effects. When you take a medication by mouth, it goes through your stomach, it gets into your veins, it goes all through your body. It goes to your left eye, to your right kidney, to your left foot. At the end of the day, the amount of medication that gets to the spinal cord here is what's actually working. We bypass all the side effects and the high doses of medication by trickling in a much lower dose using just this pump. Multiple medications can be put in it. Narcotics can be put in, just like patients who take oral opioids. We can replace those with medications in here. There's other medications that we can put in that help with nerve pain. There's also medications we can put in that help with muscle spasms. One of the biggest causes of back pain and pain in general is just muscle spasticity and spasms and that aching, sore feeling patients get all the time. There's medications that go in here that help with that as well. Now, it seems daunting to move forward with an intrathecal pump, but what we do is a test injection first. It's a 5-minute procedure, much like an epidural or any other pain procedure, all done under sedation at a surgery center. While you're asleep, we just put a little tube up to the location where the pump would eventually inject medication, and we put just a little bit of medication that lasts only a few hours. And that's the test phase. You have a few hours to see how well it's taking care of your pain. Most often, patients come back saying they were completely relieved of their pain or nearly completely relieved of their pain. And if that's the case, then we can talk about moving forward with putting in this pump so we can pump medication continuously through a catheter that goes to the same exact spot. Overall, we've had high success rates with these intrathecal pumps. Dr. Salazar, who's also here at California Advanced Pain and Spine Specialists, is one of the highest producing intrathecal pump implanters in the country. We manage hundreds of these pumps. We see them every day, manage them every day, and are very well attuned to taking care of patients who have pumps, filling pumps, and dealing with any issues that may arise with them. Also, with the pump, because of the reservoir, we only need to fill it once a month. So just like patients would have to come once a month to get prescription refills, instead of doing that, you come and have your pump refilled, but you're at 1/10 the dose you used to be at, or even less. And you don't have to take any medications with you wherever you go. There's no medications to take at all. It's a very good option for anyone with any type of pain. The refill process for an intrathecal pump is very simple. We do it in our office, just in our clinic, and it takes about 5 minutes to do. We have an ultrasound we use that scans down over this pump, and we find this little fill port in the middle. Once we find that, we just numb your skin on top, a little needle goes in, takes out the remainder in the reservoir, puts fresh medication in, and you're good to go. It's very simple, it's pain-free, and patients do very well with it.